Welcome to Eugeria Live, brought to you by Griswold Home Care. Eugeria is a Greek word meaning health of body and mind in aging individuals. Eugeria Live is a weekly show celebrating the heroes that contribute to the Eugeria of our elderly and disabled population. Now, joining us in the studio are your hosts, John Butler and Sam Grass.
Welcome to another broadcast of Eugeria Live, where we discuss topics and issues that relate to the health and well-being in our senior population. Joining me as co-host is John Butler. Good morning, John.
Good morning and welcome, everybody. It's great to be with everyone today. Griswold Home Care has been actively involved in providing senior home care services in the Atlanta area for over 28 years. And consistent with what we do is to provide services, knowledge, information to our families of seniors, including services that are available outside of the home care industry, really. And consistent with that is our special guest today, Scott Morrison with First Care Management. I've known Scott and worked with him for many years. He's a well-known, highly respected professional in this industry, and I'm delighted to have him with us today because what he's doing today is very unusual, maybe unique, and it's very powerful service provided to people, especially now that they're in their home. Scott, welcome.
Thank you, John. Thank you, Sam.
So, Scott, what you do is very unusual, and normally I just like to find out what's really sets you apart. But in this case, what you do is so different and really very powerful. Tell us just what it is that First Care Management does.
Yes, John. We are a mobile geriatric family practice and internal medicine group physician group, and we cover all of Metro Atlanta. We go to people's homes. Insurance does pay for it. And so when people are homebound, which virtually all elders during this pandemic are, we take the medicine to them.
So especially now with the pandemic, that's extremely important, but you were doing this before the pandemic and making a big difference in a lot of people's lives. Give me an example without the pandemic of the services that you were providing and why this actually got started.
Yeah, we have three different types of services that we offer. The first is transitional care management. So any person that has insurance that goes into a hospital or into a rehab and then goes home are eligible for home doctor visits for the first 30 days post-discharge. That's called transitional care management. Your insurance pays for it. The very best medicine is to go see your family practice type level doctor, because a lot of times when you're in a facility, they give you medicines based on their convenience, and we get it back the way you're used to. We get to see you discharged in your environment, and we can write orders that'll help you to stay at home and out of the hospital and age in place in the home of your choice.
I remember there was a case that you and I worked together, a very challenging situation where the man and his wife, frankly, the wife couldn't have gone to the hospital unless she was in an ambulance, and he was not very good at caring for her. And you guys came into their home, provided prescription management, a lot of services that I really had never seen done in the home before. Describe that situation a little bit.
So that was chronic care management. If you live with two or more comorbidities or one diagnosis of cognitive impairment, which certainly that client did, then you qualify. Your insurance will pay for us to be your primary care physician and deliver family practice internal medicine services in your home. Now, in that particular case, you and I kind of went above and beyond because there was no other family to step in and do some of the things that we did as far as cleanups and moving beds and finding new beds and all sorts of stuff. But basically, any person who is living with two comorbidities, their insurance will pay for us to deliver the medicine to them. If you are double insured, so if you got the supplemental insurance, it costs you nothing. If you are used to paying a copay, we're family practice, so it's the lowest copay. It's not the specialist copay. So $20, $25, something like that. We have a large roster of practitioners Therefore, we usually can get to you quickly. Even if you were transferring home under transitional care management and you couldn't get an appointment with your regular doctor for 3 weeks, we could get into your home in about 2 days and adjudicate anything that might happen during that 2 weeks before you could get to see your doctor.
So do you typically replace the primary care physician, or you augment that?
Under transitional care management, we are augmenting that. Under chronic care management, we are the PCP. But you can still go see any doctor you want to. Only one physician at a time can bill for chronic care management, but that doesn't mean you can't go see other physicians or go see your regular family doctor if you want to. It's freedom of choice. The good news is, for us to see you, you don't have to get ready. You don't have to find a ride. And typically when any of us go to a physician, they spend on average 7 minutes with us. We're going to stay anywhere from 45 minutes to an hour and a half, because we're not only assessing the comorbidities that you're living with, but also the environment in which you're operating. So we might look in the bathroom and say, we're going to send your home health in order for an occupational therapist to come measure for grab bars. You know, you might qualify for Meals on Wheels. We're going to send your home health in order for a social worker to come and connect you to those resources. And these little things add up and help you stay out of the hospital. And we educate, you know, so you're on a new medicine, what do you need to know about that medicine?
So it sounds like you're doing geriatric care management plus palliative care plus coordinating care for occupational therapists, physical therapists. I mean, there's a lot that you're doing there.
Well, we're doing everything that a family practice and an internal medicine practice that does have a case that approaches their practice via a case management standpoint. We're doing that, but we work very closely with a lot of the geriatric case managers. We work very closely with a lot of the palliative programs, because while they'll treat the pain, which in this opioid crisis is medication that, you know, our doctors don't want to write because they're being, you know, it's all being tracked. And then we can handle the diabetes and high blood pressure. And we work hand in hand with hospice. If someone's not eligible yet for hospice, we will treat the person. And if they become eligible, then send that hospice in order to evaluate and, if appropriate, treat.
Scott, let me ask a question. I might be getting into the weeds here. I come out of the benefits area, and you said that the insurance typically will cover this service. You're talking about a service delivered in the home, which up until recent, in my knowledge, it was not covered. Is this a new policy for insurance companies, or can you speak to that?
It has been around for several years. It's not been used as much simply because most people didn't realize they had that benefit. And many of the case workers at the hospitals and the rehabs didn't know that that benefit existed. We're also offering telehealth. If you're shut in because of COVID and you don't want us in either, we could do a telehealth call. And I'd say about 60% of family practice can be done via telehealth. There's certain things like wound care where you really need to go in and get your eyes on the problem. But we do have relationships with mobile behavioral health, mobile X-ray. So there are a lot of services that one can receive in their home. And I believe that post-pandemic, a lot of these delivery methods will remain in place.
Mainly because it's just a whole lot more convenient, especially for elderly, to not have to pack up and go to the doctor.
Well, it's like we partner with behavioral health coaches at Atlanta Regional Commission, and they may have 6 clients in one high-rise building. And before, it would take them 3 days to go to the doctor with those 6 clients, because they would go to 2 a day, because the client would have to take, say, MARTA mobility to the appointment, and then the case manager would meet them there. With us, our practitioner meets the case manager at the front of the building, and they go do 6 appointments all in the same day. So it makes things a lot more efficient. And people can get the turnaround time they're needing, prescriptions refilled, durable medical equipment ordered, all sorts of, and too, John, it's more when we see some of the needs that are there because of the experience that our team has in this area, we're familiar with a lot of those resources and where to get them. So we'll make the recommendation to the adult child to give this person a call or that person a call, what have you.
So this is so different than the other kind of typical things types of services I'm familiar with. What is the closest parallel to what you're doing? Is it like having a concierge physician that comes to your home, or is it more like, what is it most like that we are already familiar with?
It is most like a concierge physician, except you're not having to pay up front to do it. Your insurance pays for it. And we're in network with most all insurances. There's a few that don't pay for home visits, so we're not in network with them.
That's pretty remarkable. What is the one thing that you could tell our audience to encapsulate what you do, to remember when to reach out to you?
Well, certainly for all adult children, if you're a caregiver, your plate's full. If you're a caregiver during the pandemic, your plate is overflowing. So if with one call you can get a doctor's appointment handled, prescriptions refilled, any ancillary other services, blood work, urinalysis, x-ray ordered, resupplies of durable medical equipment, all that sort of thing, plus an annual wellness visit, that's one less thing off of your plate. And it's a sigh of relief. It's something that we hear more from adult children than we do the clients about how relieved they are that we exist and that we're prompt and that we turn things around. The home health agencies, we work with all of them, and they really like us because our notes are so clean. They read these nursing notes and the visit notes, and it's very clear to them what they are supposed to go do. They have forms that have to be signed by the primary care provider in order for them to get paid by Medicare. And we turn those forms around very fast for them because this is all we do.
Scott, what would you say would be the takeaway or the tip for our audience? Because this is an unusual, as far as I know, unique service. So how can you encapsulate what it is that you do so people will know what to remember about what's significant about what you do?
If you're the caregiver of an elder who's homebound, doctor's appointments are always a challenge. First Care Management delivers those appointments in the home at the family practice and internal medicine level, and insurance pays for it. No more having to take off an entire day to get mom to the doctor. Now you could just be there for the appointment and go on to work.
Eugeria Live is brought to you by Griswold Home Care. View this show again on YouTube, Facebook, LinkedIn, or our website at www.eugerialive.com.